The House of Representatives will vote today on the revised plan to repeal and replace Obamacare. House Majority Leader Kevin McCarthy said last night, quote, "We will pass this bill." It gained the support of GOP holdouts after an amendment added billions to cover costs for people with pre-existing conditions. Our latest CBS News count shows that at least 16 Republicans say that they will oppose the bill. It can pass with up to 22 no votes from GOP members. So let's bring in Dan Diamond. He's the author of the Politico Pulse, Politico's morning briefing on healthcare and the politics and policy. So let's talk about this, Dan. Starting with this CBS News whip count that we just mentioned, 16 Republicans say that they're probably going to vote no. But is that about what your reporting is showing as well?
I think so, Anne-Marie. Okay. It's important to know that the public whip count is a little different than the private whip count that the leaders have themselves. And there are some folks who are on the fence who may swing over if leadership desperately needs them. It's going to be close, but it looks like they have the votes as of now.
Okay, so here's the thing, though. If the bill does pass the House today, it then moves on to the Senate. And you tweeted last night that the bill would change in the Senate, of course, and maybe significantly. But health reform is unkillable, and GOP pledge to repeal has boxed them in. So what do you mean by that? Do you mean that perhaps the Senate can't change it that much?
I love, as a reporter, having time to explain my 140-character tweet.
Yeah.
So let's take that in pieces. First, it's going to change because it needs to get support from moderate senators. One change might be more money for Medicaid expansion, more money for health care coverage. Those pieces will be needed to get the folks who are on the fence on board, especially folks like Dean Heller, the Nevada senator whose state has seen almost 400,000 new Medicaid enrollees through the ACA. I think the fact that health care is unkillable, we've seen it, Anne-Marie, even this past couple months. It looked like the bill was dead. House leaders said as much, and yet here we are on another decision day. So they have made this pledge to their voters, to their constituents, their base for years, and they're very worried that if they don't follow through, that pain, that punishment will be worse than passing a bill that, frankly, is very unpopular and also will have ramifications. They're boxed in because neither choice is all that appealing.
Yeah, and Dan, you'll remember during the last incarnation of this bill when they tried to pass it and failed, the president was very influential. He made a public show of trying to woo lawmakers over to his side. And when he couldn't woo them over, he tweeted out threats. Do we know anything about his role in getting this particular form of the legislation to the floor and hopefully passing? What's he been up to?
Well, I think it's important to know, Anne-Marie, that those threats that he was tweeting out were greeted with shrugs and some annoyance. As much as Twitter might seem like a powerful vehicle for a lot of folks in those districts, they weren't worried so much about the random tweet from the president and more about what they had said to their voters and what they would tell them if reform didn't go through. So the president, in some ways, has played a smaller role in this revived health care bill these past few months. Mike Pence, Reince Priebus have been more the point men for the White House, but they brought Trump in at the end to give dozens of calls to moderates on the fence. Sometimes that's been helpful. Other times those moderates, Representative Charlie Denton, Pennsylvania, has said, I still can't vote for this. So he's been used strategically, but he's not at the forefront the way that he was earlier in the effort.
You know, we've seen video from some of these town hall meetings that gets really, really heated. Often they are heated about health care. During the last incarnation of this bill, it was the more conservative members of the party who did not like what they saw. Now it was the more moderate members of the party that Donald Trump had to convince. Will all the members of the party be able to go back home to their districts and trumpet this bill, if you will? Is this something that the members of their districts will be happy with?
I think that's going to be one of the defining questions of the next year and a half. No matter what happens, this bill is now going to get a House vote. There will be hundreds of House Republicans who will have voted to repeal major parts of the Affordable Care Act, which touches millions and millions of people. This bill is not popular. There is no poll that I have seen, Anne-Marie, that says that the majority of the country is in favor. And in fact, in about 2/3 of Republican districts, the bill is less popular than the ACA by a considerable margin. So there will be some holding to account among the broader population. It's among the Republican base that these congressmen are worried about, that the Republican base so badly wants Obamacare repealed that if these lawmakers don't do it, they're worried about facing challenges from conservatives next year.
So if the Republicans pass this bill, does this mean that health care now lands in the lap of the Republican Party? You know, up until now, they've been able to blame the Democrats, blame President Obama for the faults in the health care system. Does this mean they pass that baton to themselves?
I think you've kind of answered the question with what we've been talking about. They clearly own it already. Every poll that I've seen has showed the majority of the country thinks that if President Trump and the Republicans change the Affordable Care Act, change the health care system, can't blame that on Democrats. Republicans control the government at this point. And the more changes and more reforms that they push, the more it will be linked to the Republicans throughout this year and into the 2018 midterms.
Dan Diamond of Politico. Thank you so much, Dan.
Thank you, Anne Marie.